61. Once again, October is Breast Cancer Awareness Month, and joining us today is Dr. Kristen Zarfos, breast surgeon and director of the Comprehensive Women's Health Center at St. Francis Hospital in Hartford. Thanks so much for being with us.
Well, thank you for having us.
We appreciate you coming back every year. It's so important. And right now we're talking about Pink Link. It's happening this weekend. And the important thing for women to know is that if they don't have health insurance, that's not a problem here, right?
Absolutely. At St. Francis Comprehensive Women's Health Center, in the breast program, we have an abundance of funds thanks to many generous donors. And so this coming Saturday, day after tomorrow, we're having an event for free mammograms, which we've done for years. Mm-hmm. We have provided free mammograms, 300 for the last few years. But women should know, going to our website, that if they can't make it on Saturday, if they call or contact the breast center, mm-hmm. they can have the availability of a free mammogram. Mammograms save lives, and we never want socioeconomic status to interfere.
Right. And it's important to remember that is not going to keep you from getting your checks.
Absolutely.
Right?
Absolutely.
If you don't have health insurance, it's not a problem. There are a lot of other ways.
Absolutely. And we have seen women, because of COVID, not come in because of their mammograms, because they haven't been insured or underinsured with big deductibles. That they should not fear that. There are the funds available. There's also a law that was passed and signed in July as of January 1st that if a woman has a big deductible or a big copay, that should not be a barrier either, because that state bill says that you don't have to pay for screening mammograms, screening ultrasounds for dense breasts, or other studies. So finances in this time of inflation should not be a barrier to taking care of yourself.
And it's important because we have known for so long that it is early detection that can make such a difference.
Absolutely. 40% more women are alive in America today since starting mammograms in the 90s. And if a woman has a mammogram, she has a 50% lower chance of dying from breast cancer. So early detection in colon cancer, all diseases, but in this we have the numbers, and so we don't want women to be fearful about the actual procedure or the financial burden.
Right. For some women who have never had one, it can be a little intimidating, especially if they've not had insurance, they don't have a lot of experience seeing doctors or healthcare professionals.
Right. So I like to tell people who say, oh, they're going to squeeze my breast. Right. 5 or 10 minutes of a little pressure gives you 365.5 days
of peace of mind.
Of peace of mind. That's exactly right.
Yeah.
That's exactly right.
Dr. Zarfos, is there anything else people should keep in mind, women should keep in mind?
Yeah, I really think we need to focus on those groups of women who don't realize how important it is to have a mammogram. So the highest incidence of breast cancer is in women in their 70s and 80s. And a lot of women in that age group will say, nah, I'm old, I don't need a mammogram. Absolutely not. That's the highest risk group, and we want those women to have mammograms, because if they have a cancer, we can find it early, take care of it, and maintain their dignity, showing them respect for their quality of life. The other group that we need to think about are women who have a high family history of breast cancer. 30% of Black women develop breast cancer before the age of 50, so having a mammogram when you're younger is really important. If you have a male in your family, you're at increased risk of breast cancer.
Right.
Women of Jewish Ashkenazic descent, or women with genetic mutations. But in general, for the population, young women shouldn't think, oh, I'm not going to get breast cancer. So women should talk with their doctors or providers, APRNs, PAs, whoever take care of them, and ask them, what is my risk? Should I have a mammogram before 40? The American Cancer Society says start at 40, every other year, or every year, continuing into your 70s. On the other end of on age, we continue to order mammograms when women are healthy.
And this is not just a women issue. Everybody should keep this in mind. Husbands, children, uncles, you have women in your lives that are important to you. It's on you also to remind them to get their mammograms as well.
My husband always reminds me it's a family disease.
Absolutely.
But there are also 2,500 men who develop breast cancer. We don't do screening mammograms on them, but if a man feels a lump in his chest, anything unusual, please see your provider. Have it checked out.
Dr. Zarfos, thank you so much. We'll have the information on our website, but again, it is trinityhealthofne.org/pink for all the information.
Right.